Not only our studies, but many others. There are several ways or several topics that are discussed, including in this meeting. For example, we are now aware more and more about what we call the pre-MDS states. Usually, still today, we are starting treating patients when they are diagnosed as having MDS. But as you can imagine, and it doesn't have to be only issue in MDS or in hematology, sometimes when you diagnose a disease, it might be too late, because sometimes it might be the case that some damage has been caused and the damage not necessarily is reversible. Sometimes it is irreversible. So the idea in medicine in general, and obviously in hematology, and now also in MDS, is to try to detect the patients at risk. And we are familiar now for several years with several states which are termed in the general term pre-MDS conditions. These are called CCUS, ICUS, and so on. And these are the situations in which some of the patients, not all of them, might develop in the future MDS. Now, obviously, we are only in the beginning of this era. Most of these situations are recognized by genetics, but we are starting to have some ways to interfere in that, and to have some intervention, probably to at least to diagnose or to identify those who are at higher risk, and maybe to treat them in order to prevent the progression of the disease, and obviously at the end to prevent the transformation to acute leukemia. So this is just in the beginning of that era, but we are there already. The beginning, but they are there. So this is one direction. The other direction is really the more modern tools that we are using, and obviously I would like to mention two major modern tools that we are using, and we did not use them in the past, although it's not really new for 2023. And I mean, number one, to the genetics. Obviously, we have been with genetics now for more than 2 or 3 decades, but the techniques are becoming more and more accurate and more modern and helpful and useful and practical. We are having now a new classification which is called IPSS-M, which allows us to do NGS, or to do molecular studies to patients at diagnosis and to better classify the patients. This classification has shown that by applying it, you may change the stage of the patient in about half of the patients, 46%. What does it mean? It means that now we can better predict the prognosis, what will happen to the patients, and maybe to adjust better and to apply a more appropriate treatment to this patient. So one way of becoming more modern and more advanced is really applying modern, new genetic techniques almost on routine basis. In many countries it's already routine, and it's on the way. Still not the whole world is doing genetics, but it's becoming more and more popular and more used. The other tool is what I mentioned earlier, is the AI. Today, with the power of the new computer technology, artificial intelligence, and other digital tools, we can do things that we could not dream in the past, including collecting lots of data, clustering the patients, identifying and having a prediction of the future. This is, again, just in the beginning, but we are there. And I'm sure that in the next few years, we will see more and more such studies, which will definitely lead to better identification, better prediction, and hopefully better treatments with better results.